know that our spine or the vertebral column is always subjected to a great deal of stress and strain? A great amount of forces are acting on the spine not only during the movements or functional tasks but even during rest. And that is why we have this topic, the kinetics of the spine, the forces that are acting on the spine. In previous section, we had described the kinematics of the spine. What are the movements that are going to happen in the spine in general? And this session purely focus on what are the forces that acts on the spine in general. Which forces can deform the spine, which forces can distract the spine, and what are the other type of forces that act on the spine. As I told you, spine is subjected to various forces during even at rest. That is, when you are sitting on a table with your arm on the table, your shoulder complex is relatively at rest. But your spine, even when you are sitting, it is under various loads, or it is sustaining various amount of stress. When you lean forward, when you sit, one side of the spine is being compressed and another side is being distracted. When you lean on one of the lateral sides, right or left side, the same thing happens. That means the spine is always under various forces or various compressive and other type of forces, and that is why kinetics of the spine is very important rather compared to any other complex in the human body. And since it is that important, and since it is a vast discussion, definitely it can be academic point of view question too. So let us expand our concept into which are the kinetic forces that act on the spine. As I told you, spine is subjected to various kinetic forces or various stresses throughout our lifetime or throughout our daily life activities, even at rest. Those forces are known as the axial compression or distraction forces. The axial compression or distraction forces are also known as tension forces. The bending forces that act on the spine, we'll study that later. The torsional forces, we'll understand that too, and the shear forces. So these are the 4 or 5 forces that always act on spine, the different stresses that spine is subjected to. But still, a spine is able to overcome that forces or withstand that forces due to various factors. Let us look into what are the factors that helps spine or that determine the effect or response of spine to these factors. This loading, they are the type of the loading, which type of load, whether it is the axial compression, whether it is a distraction, whether it's a torsional force, whether it is a bending force, whether it is a shear force, etc. This type of the loading determine the duration of the loading, whether it is a sustained load or it is a load for a moment, for a few seconds or a few milliseconds or a few minutes. It depends or it do have an effect on the response of the spine. The rate of the loading, how fast the loading is done. Is it a fast loading or it is a same load sustained over a long time? It depends, or it has a rod. The person's age and the posture. Definitely you know that the spine complex, the vertebral column is subjected to greater amount of degenerative changes with the age. As age progresses, that has an effect on the spine's response to these forces. The posture, for example, a person having a scoliosis may react different to the different type of loading that the spine is subjected to. The condition and the properties of the structural element or the structural elements, you know that the psychoapophyseal joints, the interbody joints, the intervertebral disc, the lamina, the pedicle, the posterior elements, other posterior elements all have some role in the response of spine to these forces or kinetics. And finally, an intact nervous system. You know that the nervous system has a control over the muscles as well as a proprioception and joint receptors, etc. And as a result, all these factors determine the extent or the way in which our spine is going to respond to different type of loading. That's all about the general introduction into this section, and we are now going to see which are the different type of loads that acts on the spine. The first one is the axial compression, the axial compressive load. Okay, what you mean by compressive load? Compressive loads or axial compressive loads are compressive loads that are being subjected to spine in the longitudinal axis of the spine. The forces will be acting through the longitudinal axis of the spine and perpendicular to the, we have the intervertebral disc here, we have the spine over here, we have again the disc over here, we have again the spine, the vertebra over here. Now a load which is acting through the load which is acting through the compressive, the longitudinal axis of the bone will cause what type of load? A compressive load. A compressive load will be acting on, and this sort of compressive load will be perpendicular to the intervertebral disc. So longitudinal, the load or stress that act through the longitudinal axis of the spine perpendicular to the intervertebral disc are known as axial compressive loads. These are known as the axial compressive. Now let me ask you, what are the scenarios in which the axial loading can take place in our life? For example, there is a factor known as the gravity which always pulls our body downwards. So that is one force. There is a ground reaction force that opposes the gravity or that acts on any surface that is in contact with the ground, and that is being transmitted through our body from lower limb to the spine. That ground reaction force can be there. The ligament and the muscles, the constant lengthening and shortening of the ligaments and muscles in and around the spine complex. We have a lot of ligaments and muscles around this compression and the shortening or contraction of the ligaments, the pull and push of muscles, etc. can provide compressive load. If a person is carrying some extra weight on his head or his shoulder, that can act as a compressive load. The superimposed body weight of the head, arm and trunk also can act as a compressive load. Okay, so these are some instances or some scenarios where compressive loads can act on the body, or these are some examples of compressive load. What are they? They are the forces of gravity, the ground reaction force, the contraction of the muscles and pull of the ligaments, and any weight sustained by a person. Now we have a load. We define what is axial compression. We saw what are the type of compressive force or what are the examples of the compressive force that act on the body. Now, which are the structures that are going to resist this compressive force? Which are the structures in the spine which are going to resist this compressive force? The major structure that is going to resist this compressive load in the spine are the vertebral bodies and the intervertebral disc. The major bodies, the major structures that are going to resist the compressive loads are the vertebral bodies and intervertebral disc. And you know that these are in line with the compressive loading. So this disc and the interbody joints or the vertebral bodies are the things that are going to resist this compressive load to the first greater extent. So the first line of response to the compressive loading is from the vertebral bodies and from the intervertebral disc. Also, the associated structures like psychoapophyseal joint. What are they? They are the facet joints. Those facet joints can also resist some amount of compressive loads. The facet joints are not in line with these forces, but still they can resist some amount of compressive force, sometimes 0 to 30% of the compressive load. And the spinous process of the spine. For example, when you are trying to go for hyperextension or extension, your spinous process is coming in contact. So some of the forces from this body can be transmitted into this spinous process. So the four lines or four different structures which can contribute or resist the compressive load: the vertebral bodies, the intervertebral disc, the spinous process, as well as zygapophyseal joint. Predominant role is served by the intervertebral bodies as well as the intervertebral disc. Clear? Now we need to understand, we know that the disc is a very crucial structure. What is the role of intervertebral disc in maintaining or resisting the compressive load? Okay, now when compressive load is acted on, the intervertebral disc behaves like a bag full of water, a bag filled with the water, or a balloon filled with air. So what happens is that when for example, I will show you in this one. Okay, when a compressive load is acted on like this to the intervertebral disc, you know that the nucleus pulposus in the disc is the one which acts as a bag of water. It is the gelatinous thing which is more fluid rich. So what happens is that the nucleus pulposus act like a bag of water, and it begins to expand to different directions. For example, for better clarity, let us draw the diagram over here. Now we have the nucleus pulposus over here, and a compressive load is being applied. Now what happens is that it is like a fluid filled cavity or a fluid like structure which will try to expand to different direction. It will try to expand to different direction. So what do we have in this outermost layer? We have the annulus fibrosus. So when a compressive load is acted on, the nucleus pulposus tries to expand to different direction, but you have the annulus fibrosus covering it like a ring-like structure, and thus this will transmit the force to the annulus fibrosus. It will transmit the load into the annulus fibrosus. At the same time, you have here superiorly and inferiorly what? The vertebral end plate. So it will transmit some degree of a force like this into the vertebral end plate also. It will transmit some amount of compressive load onto the vertebral end plate. So this is the general pattern in which the disc behaves during the loading phase. That is, the nucleus pulposus in the disc behaves like a fluid-like cavity or a balloon filled or a balloon filled with a water or an air. And at this time, when there is a compressive load, the nucleus try to expand into different direction. Then they have the annulus surrounding it, so it will transmit that forces into the annulus. Then at the same time, it will transmit the forces into superior and inferior vertebral end plates also. So there is a normal rhythm or a normal resistance provided by this annulus and the vertebral end plate, so that there is always a state of equilibrium. There is no bulging out of the disc, or there is no possibility for the nucleus pulposus to come to a direction like this or expand to one corner, etc. Because there is always a balance or equilibrium between the activity of annulus and the vertebral end plate. But during the scenarios like disc bulge and other associated conditions, definitely this balance can be altered, and it can create pathomechanics or pathologies to the spine or to the intervertebral disc. So this is the normal mechanism in which the intervertebral disc is going to act during various stresses or forces that it is being subjected to through the compressive loading. And the structure which is very brittle or which has less role in withstanding the compressive load is the vertebral end plate. So when there is an excessive compressive load, the vertebral end plate would be the thing that fall off immediately or at the first moment. Only then the last structure that would be fall off or fall apart is the intervertebral disc, because it is gelatinous and it has various collagen and associated structures which can help in withstanding the compressive load. Okay, now that's the role of an intervertebral disc. What is the role of in body of the vertebra? You know that the body of the vertebra is definitely made up of the trabecular bone and the cortical bone, or the cancellous and the cortical bone. So this trabecular bone will help in withstanding the forces that is being transmitted in the vertebral body. It will help in dissipating the force in a better direction. So you know that from the vertebral end plate, the force is being transmitted into the vertebra, superior and inferior vertebrae. So this cancellous bone and the trabecular system in the bone can help in withstanding the forces that it been acted on. We had discussed what are the trabecular system of vertebral body in the previous video, in the first video. If you haven't checked out to that, kindly check on to that, then you can understand this in a better manner. So in scenarios in which like after a 40 years of age, the trabecular system is being lost or overtaken by the cortical bone itself, because as the bone mineral density decreases, the trabecular bone number or size decreases, quantity decreases. So in those spine and in those people, the ability of a body of the vertebra to withstand this compressive load can be altered to some extent. So this is a general mechanism through which axial compression force is being managed by the spine. And there is another scenario which you should remember, or another condition which we had already discussed in the second chapter, that is the creep. So we have to bring that concept into this discussion. How can you bring that concept into this discussion? You know that the property of the spine, or the property of the intervertebral disc actually depends upon the rate of the loading and duration of the loading. I told you earlier, right? So when a viscoelastic substance, that is what creep says, is loaded, initially it shows an elastic phase. For example, when you are just pulling on a rubber band, what happens is that it begins, when you tie a rod, when you try a small weight into a rubber band, it usually expands. So that is the initial phase, elastic phase. But what happens if you sustain that load over there? It will try to elongate and deform. That means if the load that can produce an elastic response in the soft tissue, if it is sustained for a long duration, then it can result in deformation of the structure. Similarly, in the intervertebral disc, this creep comes into action. How is that? So for example, when in our normal daily life activity, for example, I wake up at 6 a.m., even though that's not reality, still when I wake up from 6 a.m. to the night 10 or 11 when I'm working, I usually walk, I usually run, I usually climb stairs, I do various activities. All that time my spine is under constant loading. So when that loading goes on increasing, initially the soft tissues will give an elastic response. The intervertebral disc will give an elastic response. That means it will deform, it will come back. It will deform, it will come back. It will deform, it will come back. But when that loading is sustained for a long time, for example, I am carrying a weight of 10 kg in my head for a 2 hour or a 1 hour or 30 minutes, what can happen is that the loading is constant, sustained loading is there. Then the property of the intervertebral disc can change. You know what is the substance, which substance makes the intervertebral disc? That is water, the fluid content. So when there is a sustained loading, the water in the intervertebral disc can be pushed outward. It can disperse out some amount of water. So it will disperse out some amount of water, and as a result the disc shrink. Where will that water go? Will it go to the intervertebral foramen? No, it will be absorbed by the cortical bone and the cancellous bone of the vertebral body. So at the end of the day, when I am tired, I go for rest. My spine says, yes, he is taking some rest. Let me imbibe that water again. Let me absorb that water again. So at that time, there is no loading. So during that phase, the spine will absorb the water again from the bone. And it will, the vertebral disc will absorb. So it will finally result into its normal shape. It will come back into its normal shape. Again, next day in the morning, I do the same activity and the process and cycle continues. And that is why sometimes at the end of the day, the person's height itself can be decreased, because you know that 23 intervertebral disc is there. If they all decrease in even in 10 millimeter size, it can ultimately result in a slight change in the height of a person in the end of the day. But when you go back to sleep, when you go for rest, it can come back to its normal. So there is this interesting thing that there was a scenario in which a scientist, as astronaut, went to the space. When he leaves for some time and he returns back, even NASA, who has sent them, has seen that there is even size change by a few inches. That is because there is no loading. So the intervertebrate disc can absorb more water and increase in size. I don't know how far you will believe it, but that's the truth. So this is all about the scenario of compression. Now let us move on to the second one, that is the how bending force can affect our spine. The second thing is the what you call the bending forces. The bending force can have, the bending stress can have a different reaction in the spine, or a different mechanism of action in the spine. For example, when I am bending forward, what is actually happening? Can you just predict down? There is compression in my anterior aspect, whereas there is tension or distraction in my posterior elements. Am I right? Yes. When you are bending forward, your anterior structures are being compressed, whereas your posterior structures are being distracted or they are under tension. So what are the anterior structures? The anterior part of annulus fibrosus, right? The anterior longitudinal ligaments, the muscles in the anterior abdominal wall, or those are the structures which are seen in the anterior aspect of the spine, and those structures can go for the compression. Those structures can get compressed, whereas the posterior structures, which includes your posterior longitudinal ligament, the zygoapophyseal joint capsules, the zygoapophyseal joint capsule, the spinous process, and ligamentum flavum, etc. Those posterior structures can go for distraction or tensile forces. When you are leaning backward, the same opposite. The anterior structures are going for distraction, whereas posterior structures are going for compression. So in leaning backwards, or when we are going for extension, the anterior structures of my spine is going for distraction. For example, my anterior annulus, my anterior longitudinal ligament, muscles in the anterior abdominal wall, they go for eccentric contraction. All these structures go for lengthening, or they are under tension. Am I right? Yes, the posterior elements are under compressive loads. What about the other scenarios for bending? Bending forces, when you are lateral bending to the right side, my right side structures are compressed, while my left side structures are relaxed or stretched out or under tension. So when I'm going for left side bending, the same scenario happens. Left side structures are compressed, right side structures are stretched out or under tension. So what happens normally is that if you are returning to normal, then this tension forces cannot have some predominant effects in the spine. Usually when you go for leaning, that bending forces can create compression and tension, but when you come up back straight forward or to an upright stance, definitely they can return to its normal. But in scenarios where you take a habitual posture of leaning forward or flexed forward or stooped forward, what happens is that your those structures can go for the next stage in the stress strain curve. They can go outside the elastic region. You know that when it is in the toe region or in the elastic region of the stress strain curve, after the force is being released, the structures come back to the normal. But when this deformation is beyond the elastic region or in the plastic region, it can result in the injury, or that can result in permanent damage to the structures. So that is why in cases of some postural abnormalities like forward stooped posture or some upper cross symptom, etc., when you try to recorrect it, or in case of kyphotic posture or scoliosis, etc., when you try to recorrect it, the problem also is that they had that posture for a long time, and as a result their soft tissues are already in the plastic region, so the deformation would have been already done. So if you assume some posture which is not good for your body, immediate correction or daily stretching activity or immediate correction can help you a lot. That's some clinical aspect, but let us come back to this normal. So as long as the force is in the elastic region and taut region, no deformation, no permanent deformation, they come back to its normal. But if the bending forces are beyond this elastic region and into the plastic region, they can create a great amount of forces. So when there is a compressive force in this aspect, when there is a stretching forces in this aspect, there is a balance between this compressive and stretching force, so that the movement is limited. A stretch in the posterior ligaments and posterior associated structure limits the extension. The stretch in the anterior associated structures limits the flexion. So there is actually a balance between this, like the balance that existed in the previous discussion. So this is the general mechanism of bending force. So if you summarize the bending force can have a predominant effects like it first differs with the position of the body or movement, the motion of the body. If it is in flexion, it can cause anterior compression, posterior stretching. If it is in extension, it can result in posterior stretching, anterior compression. If it is in lateral bending, similar to that, you have to write on to that. Okay. Now the next force is the torsional force. What are the effects of a torsional force in the torsional force? What do you mean by torsion force? Torsion forces are some twisting or wrenching forces which tend to rotate to one side of the body, or one side of that part or of an object is twisted to one direction, whereas the other side is twisted to opposite direction. So normally there is less torsional forces except when there is an axial loading along with some coupled motion in the spine. When there is a coupled motion in the spine is having torsional loading. Okay, when there is a coupled motions in the spine is having the torsional loading. It tends to move one side of the spine to one side and other side to another side to the opposite side. And which structure is capable of withstanding this torsional loads in the spine is the annulus fibrosus. The great extent is by the annulus fibrosus. The fibers oriented in the annulus fibrosus can help in withstanding these forces. But at the same time, if this torsion is combined by axial compression, bending, etc., then it can result in a fail. It can result in a great amount of stress that cannot be withstood by the annulus. Normally, when torsion is subjected, some part of the annulus rotates, gives resistance to a clockwise rotation, while the other part of the annulus provides resistance to the anti-clockwise direction. So that is how that spine balances the torsional force. So the torsional force in the spine is critically balanced by the annulus fibrosus. Annulus rotates, or annulus acts in such a way that with this longitudinal axis, some part resists the clockwise stress, whereas other part resists the counterclockwise stress. And we have one more scenario which is known as the bending moment, which is known as the shear force which is acting on the spine. So what do you mean by shear force? It's simple. Force which can result in slipping of one vertebra on another. Force which can result in slipping of one vertebra on another. So this type of the force which can provide slipping of one vertebra on another is the one that is known as the shear force. And what are the structure, or which is the structure that can withstand the shear force? Definitely, you know that if this is the vertebra, we have here the posterior elements and the zygapophyseal joints. So the zygapophyseal joints and the intervertebral disc are the structures which can resist the shear force. So in usual scenario, the zygapophyseal joint and the facet joint, that's the facet joint, and the capsule of that zygapophyseal joint resists the anterior and posterior shear forces. And they are very efficient in withstanding the anterior shear forces, and as a result gives stability to the spine. That is also has some role. So torsion and the shear force do not have a great So that's about the torsion and the shear force. Where in the torsion you have the annulus acting, whereas in the shear force you have the predominant action by the the zygapophyseal joint. That's all about the kinetics of the spine. Be free to mention your comments in the comment section. I would love to read that. And if you like the video, don't forget to click the like button and kindly subscribe to our channel.